The unending pressure from society and the economy continues to put many people under distress psychologically. However, efforts by some to seek assistance, particularly within the workspace, is proving difficult as some institutions are failing to put in place the adequate measures to address these psychological needs of their employees. There's more in this report by Citi News's Ya Odenya, read to you.
8 a.m. to 5 p.m. arguably is the time most Ghanaians spend at work. From human engagements to checking the to-do list, that can take a toll on workers. With everyone committing to productivity, less attention is given to the ever-growing psychological changes that occur among workers. Amma, who is a victim of this situation, shares her agony with Citi News.
I had a problem with a colleague at work. It was just a small misunderstanding, but the issue really affected me mentally and emotionally. Sometimes going to work becomes a problem because waking up every morning and deciding to go to work, and at the same time thinking about that colleague in the office that we are not in good terms feels some way. So sometimes my husband will have to wake me up and force me to go to work.
Ajua, on the other hand, reflected on how her organization's support contributed to her recovery. She emphasized that mental health should be a serious consideration for all organizations.
Confidence. I really had a self-development. My first time seeing one was really pain, but when I spoke to the person, it felt like I'd known her for all my life. She built my confidence and encouraged me to speak to her. And then I think it was worth it. In Ghana, I was talking to a friend recently, and he was like, "No one in Ghana sees a psychologist." And I was like, "Whoa, we think that if you see the psychologist, like, it means that you are weak. It means that feeling to say you are mad." That's what people think, but that is not what it actually is.
According to a report by the World Health Organization, as of August 2023, over 2.3 million Ghanaians were living with various mental health conditions, yet mental health care remains a significant challenge, with a staggering 98% treatment cap. During a meeting with physicians and surgeons in Accra in December 2023, President Nana Addo Dankwa Akufo-Addo announced that mental health care would be incorporated into the National Health Insurance Scheme, NHIS, in Ghana by 2024. Despite the government's efforts to promote quality mental health care, there remains ample room for improvement, particularly within organizations where there is limited psychological support for employees. The acting registrar of the Ghana Psychology Council spoke to Citi News about the reasons behind the scarcity of psychologists in Ghanaian organizations.
As a country, we have not accepted the idea of people going to see a psychologist. And that has translated into our workplace. And so usually when somebody has any issue, the person is maybe referred to a hospital, go see the clinic doctor or something, the organization's medical practitioner. And then maybe you are given some medication and all that. And after some time, if nothing is happening or it's not improving, some institutions will lay you off. They will ask you to go home because maybe it's affecting your work. That is in institutions that want to help. Others that do not care, right from beginning, when they start noticing things, they will just let you go. Use it as a disciplinary issue against you and all that. The numbers too that we have in the country. Even though the training has been with us for some time now, we don't have a lot. When I say a lot, to even go across the country. If you look at our figures from the council here, with the numbers that have been licensed, you see that we have a lot of people in Accra and some in Ashanti region, and then also mostly in the universities that are training, that run psychology related programs. Yes, but in practice, if you go up north, maybe in northern region, you'll find just one or two people, masters. And so if you are into clinical health or clinical psychology, you do, currently at Legon, what they do is an MPhil, which is 2 years. So you would have done your 4 years first degree. You would have done your national service, gone back to do your master's, that is 2 years. And then when you complete, you do an internship of 1 year, 1 full year internship. That is when you will qualify to be licensed as a psychologist in Ghana.
Meanwhile, the indispensable role of human resource managers in safeguarding employee welfare within organizations cannot be overstated. Kojo Emisa, lead executive and principal consultant at CITAM, an HR consulting firm, argues that while HR professionals prioritize employee well-being, they are not solely responsible for addressing the psychological needs of employees. He recommended the implementation of an employee assistance program to enhance organizational functions and provide essential support for employees' psychological health.
I normally don't prescribe organizations having psychologists in-house. Rather, they need to have a program like employee assistance program which help employees deal with their psychosocial issues. And these are all psychologically based, where you need a psychologist to help you. Instead of having them on site, which at times brings the suspicion of anonymity, confidentiality, there are third-party providers, which is called the EAP providers, Employee Assistance Program providers, and they deal with a lot of psychosocial issues, starting from psychological issues, stress issues, marital issues, financial issues, and whatnot. So when an HR signs on, or let's say when an organization signs on with this third party, just like your healthcare insurance, when you need any socio-psychological help or mental health, then you contact the third party.
In a discussion with Citi News, the group head of Human Resources and Administration at the Bank of Africa, Ghana, Kojovan Skranche, disclosed his organization's efforts in supporting employees' psychological health.
At Bank of Africa, yes, we believe so much in the psychology of staff. And so as part of even our private medical care that we offer to staff, we have clinical and industrial psychologists on retainership. That if staff are undergoing any problem or any psychological issue that they need assistance, they contact the psychologist directly and deal with them. And then the bank does not even know, or the identity of these staff are kept secret and confidential from the bank. So we don't even know who has been engaged or who has engaged the psychologist at what point in time.
Experience in the public sector emphasized the necessity of psychologists in organizations. She outlined the potential challenges that may arise in their absence.
You see, people come to the organization. You give them something to do, they are absent-minded because they have issues. But the presence of a psychologist can easily look at somebody or observe someone and say that, no, this person has an issue, and would invite the person, and with his or her expertise can counsel the person, to come back to her right senses.